Hello, guys. Good evening to all of you, and I hope you guys are doing well with respect to your preparation for exams. And as you can see, guys, today our topic is endocrinology and anti-cancer drugs. Guys, very good evening to all of you. And see, these are the times when the exam is very nearby, and you should continue your revision. And if you have time, come to these live sessions. And I have been giving you weekly targets. And sometimes I'm not able to come live on Sundays because of offline classes. So then what I do is I combine two topics and discuss one time. As we are doing this time, we'll be discussing endocrinology and anti-cancer drugs together. Right. So guys, I hope all of you are doing well with respect to revision and all. And let's begin with today's question, guys. An important factor they ask you in diabetes mellitus endocrinology, most important topic is that of diabetes. And which of the following is a weight neutral drug? Semaglutide, glyburide, metformin, sitagliptin, right? So anti-diabetic drugs, some of them they can cause weight loss, some of them they can cause weight gain, some are weight neutral. Right. So which of the following is a weight neutral drug? So let us see, guys, what is the best possible answer here? Is it A, B, C, or D? Excellent, guys. See, this is a very simple MCQ. I mean, you should be able to solve this without even a drop of sweat. Sitagliptin, guys. So sitagliptin, it is a weight neutral. This is the right answer. Semaglutide, it belongs to a class of drug called as GLP-1 agonist, and these drugs they cause weight loss, and in fact liraglutide is the drug of choice for treatment of obesity. Glyburide, sulfonylurea, causes weight gain. See, metformin can cause weight loss as well as in some patients it is weight neutral. So both can be seen. So sitagliptin, it is a DPP4 inhibitor. DPP4 inhibitor. Weight loss can also be seen with your SGLT2 inhibitors can also cause weight loss. Right, so these are some important aspects they ask you about weight gain or weight loss with the drugs, and you know which is better to answer. So it's simple MCQ, guys. Second one, a patient was to be given 8 units of insulin Afrezza. The cartridge to be used is blue, black, green, yellow. So guys, sooner or later, they will ask you MCQs on these Afrezza inhalational insulin. So all of you know, Afrezza is an inhalational insulin, right? So blue, black, green, yellow. So if they ask you about Afrezza, this one point they can ask you which color cartridge has how many units. So if you remember, I've told you to remember this as BG. There are only three colors: BG, BGY, 4, 8, 12. So what I'm asking here, see, is there any problem with the video streaming, guys? Because my internet is fine as far as I can see, and it might be some problem with streaming in your end, right? So you can check that. So here, guys, yeah, 8 units. So you can see 8 units means I'll go for green color. I'll go for green color because see, I mean, the internet connection on my side is fine. If video is blurred, then you need to change the resolution because automatically YouTube shows you the least resolution so that lesser, internet is used. So what you need to do is click on the icon and change the internet setting. If video is blurred, you need to change it from your side. Change the setting in YouTube and change or select the maximum video quality. So guys, green is the right answer. Green is the right answer. So video, if it is blurred in tablets, you just have to choose the higher resolution, guys. Go for the higher resolution. While drawing insulin, NPH, and regular insulin in a syringe, regular is drawn fast as, right? While drawing insulin, NPH, and regular insulin in a syringe. So, two insulins which can be drawn in one syringe, these are regular and NPH. If I draw that, regular is drawn first because it is short acting, it is short and slow acting, it is clear and colorless, it is absorbed faster than NPH. Guys, which is the right answer? Excellent, guys. Most of you have given the right answer because it is clear and colorless. So, guys, what happens is NPH, it is cloudy white, and regular, it is clear, colorless. So, what happens if I first take NPH, then I will contaminate the regular in the sense color, and even regular insulin can look little bit cloudy. So the nurse, she might get confused looking at these two insulin and might think both are NPH. That is the reason why whenever I draw in one syringe, I draw regular first, then I draw NPH. Sometimes this is asked as an MCQ. Next MCQ, guys, a patient on canagliflozin developed UTI. The drug used for treatment of UTI is amoxiclav, that means amoxicillin clavulanic acid, fosfomycin, fluconazole, amphotericin B. So what is the answer, guys? Amoxiclav, fosfomycin, fluconazole, amphotericin B. Right, so this MCQ will separate the top rankers from the other rankers. It's not a difficult one, guys. It's not a difficult one because I've taught you this, that when an SGLT2 inhibitor, what is canagliflozin? It is SGLT2 inhibitor. It will increase what in urine? Glucose in urine. And if you remember, why did we have a lot of mucormycosis during COVID? One reason might be use of steroids, which can cause hyperglycemia, right? Because steroids are never used in so many number of patients together. So glucose in urine also increases risk of fungal infection. So this glucose, it is a reason why most common cause of UTI is Candida. In other words, in this MCQ, what I'm asking is indirectly what is the drug of choice for Candida UTI, and your answer is fluconazole. So it's just, see this, I've told you, right? The MCQs are not repeated nowadays, topics are repeated. So they'll twist the MCQs. The same thing can be asked. They had asked you earlier this MCQ in a different way. A female was started on an anti-diabetic drug. She developed vaginal pruritus. Which drug was she started on? What is the most common presentation of Candida UTI in females? Vaginal pruritus. So as I said, the way of asking might change. Which of the following drug can decrease serum triglyceride levels? Metformin, glyburide, pioglitazone, sitagliptin. Which of the following drug used in diabetes can decrease serum triglyceride levels? Metformin, glyburide, pioglitazone, sitagliptin. Your clue is you have to look at mechanism of action. You have to look at mechanism of action of these drugs and correlate that to a class of hypolipidemic drug. Hypolipidemic drug. So, guys, we have a hypolipidemic drug called as fibrates. And fibrates are PPAR alpha stimulators, and they decrease serum triglycerides. They decrease serum triglycerides, right? And the mechanism of action here, your answer is C. Many of you have given the right answer. Excellent. Pioglitazone. It is actually a PPAR gamma agonist. But remember, I have always told you time and again in my lectures that uh, selectivity in pharma is never absolute, it is relative. So these drugs are mostly gamma agonists, plus they also produce alpha agonism and they can decrease level of triglycerides. So PPAR gamma agonist, which is the only drug currently in use, guys, it is pioglitazone. So again, see, I've asked you about the mechanism of action of pioglitazone, but not in a direct way, right? It is an indirect way, which I've asked here. Next question, guys. All of the following drugs are used in postprandial hyperglycemia except pramlintide, acarbose, insulin, sitagliptin. All of the following drugs are used in postprandial hyperglycemia except pramlintide, acarbose, insulin, sitagliptin. So this is with respect to use of drugs. How do I use drugs? Right. So come on, guys. Let the answers flow. What is the answer? What is the answer? A, B, C, or D? Come on, guys. It's not that a difficult one. Only few of you guys have given the right answer, right? Many of you have given insulin. All right. Why you have given insulin? I'm actually surprised. See, insulin. Where do you use the short-acting insulin? What is the use of short-acting insulin? Is it used for maintenance? How will you use a short-acting insulin like regular, glulisine, Lispro, Aspart? It is used for postprandial hyperglycemia. Acarbose. Why are you giving acarbose as answer? It is also used in postprandial hyperglycemia. Where does acarbose act upon? Your food. So if it is acting on your food, it is going to act on the postprandial hyperglycemia. It's very simple. And pramlintide, guys, it delays gastric emptying. It delays gastric emptying, so it is only used in postprandial hyperglycemia. Pramlintide, what it does, it delays gastric emptying, means food will move slowly from stomach to the intestine. So again, it is used in postprandial hyperglycemia. What else I use in postprandial hyperglycemia? I also use meglitinides in postprandial hyperglycemia. All other drugs, they're used in maintenance. So there are only these three drugs used. So guys, answer is sitagliptin. Answer is sitagliptin. Sitagliptin is not used for postprandial hyperglycemia. It is used for maintenance, guys. It is used for maintenance, right? So remember, so I was kind of hoping that all of you will think this is an easy question and directly, jump onto sitagliptin and give me the right answer. But anyways, remember, meglitinide, why? Because it is short acting. It is short acting. I used in postprandial hyperglycemia. Pramlintide, it delays gastric emptying. Again, it acts upon food by delaying gastric emptying, postprandial hyperglycemia. Acarbose directly acts upon food, postprandial hyperglycemia. Insulin is short acting. Where else am I going to use it? Postprandial hyperglycemia, right? So guys, this is the basic concept you need to understand, right? To prevent lipodystrophy, the distance between two sites of injection should be at least 1 inch, 2 inches, 3 inches, 4 inches. So this is a basic fact. This is a basic fact that sometimes they ask you such MCQs, right? What should be the distance between two sites of injection? Should it be 1 inch, 2 inches, 3 inches, or 4 inches? Oh my God. All of you guys are specialists when it comes to inches. So you guys have all given the right answer. I'm proud of all of you guys. 2.5 centimeters. Chota Shakil. Chota Shakil, you have surprised me as your name, right? I thought you must be in Dubai or somewhere. Chota Shakil. So 1 inch. So guys, it is usually 1 to 1.5 inch. So 1 inch is a better answer, right? 1 inch is a better answer to prevent lipodystrophy. The site, the at least I'm telling it is a minimal distance that should be maintained, right? Acarbose should be taken. We have heard a lot about acarbose. When should it be taken? Anytime, before food intake, during food intake, after food intake. So these are very basic MCQs. You guys requested me not to make difficult MCQs this time. So I have not made difficult MCQs at all. I made very simple MCQs, right? But kind of, I've given you the clue in the last to last MCQ. So what would be the answer here? What did we discuss? A drug like acarbose. What did I say? A drug like acarbose. Where does it act? It acts upon food. So guys, you're telling me after first bite. I'm not asking you after first bite. After first bite is not in the option. Whatever options are there, you have to give me the right answer. After first bite, what does it mean? Anytime, before food intake, during food intake? Right. So acarbose acts upon food. So if there is no food, how is it gonna act? So we take it after 1 to 2 bites. After 1 to 2 bites, so we'll say that patient, you eat if you're eating 3 or 4 chapatis or 2 chapatis. After you take half of the chapati, then you take it. So in other words, this translates into during food intake. So sometimes what happens is, what happens is we know it. We know what could be the answer. Still, we cannot find the right option because many of you said after first bite. Guys, after first bite means what? In English, it means during food intake. It is not before food intake, isn't it? So C is the right answer. C is the right answer, during food intake. It's a very simple MCQ. Sometimes we get confused with the English language. So that is a problem. All right. Let us have a look at an image. See, after and during. After is I finish, after food means I finish eating food and after that I'll be having. During means in between food intake. The insulin given in the picture is Detemir, Glargine, Regular, Degludec. Right. So guys, which insulin is this? Can you make a guess? Which insulin is this? Detemir, Glargine, Regular. नॉर्मल बॉडी वाला, ये कौन सा आंसर है भाई? नॉर्मल बॉडी वाला नॉर्मल बॉडी वाला इंसुलिन कौन सा है? This is many of you have given the right answer, right? Many of you have given the right answer, and the answer is it is not regular insulin, guys. It is glargine. It is glargine, and see, the normal insulin is this. The normal insulin has been changed. So what I've done, threonine and lysine, you can see threonine and lysine, I've interchanged their position. You can see lysine, threonine. So the first thing I've done is I've changed the position of threonine and lysine. Then I have attached two amino acids, that is arginine, right? Here you can see I've taken these two and I've removed one. The last one, and to cysteine, I have added glycine. So what I'm adding basically, what I'm adding is glycine and arginine. So I'm combining glycine and arginine and it becomes glargine. So you look at arginine, You look at glycine, you get the answer. It is glargine. So, see, it's not a difficult MCQ. Just look at arginine. You'll get the answer. You'll get the answer if at all they ask you such an MCQ. So this is possible. They can ask you such an MCQ, and it is not a very difficult one, right? Fastest absorption of insulin takes place from thigh, arm, buttock, abdomen. It's a very easy one, guys. Fastest absorption, thigh, arm, buttock, abdomen. Is not at all a difficult one. It's a very easy one. So what is it, guys? Excellent. So why abdomen is the most common site of insulin injection, right? Except the periumbilical site. We don't inject it in the periumbilical site, except apart from that, we can inject everywhere in the abdomen. Excellent, guys. D is the right answer. So these kind of MCQs, yes, glargine rate of absorption does not depend upon site of injection, right? Its rate of absorption depends upon the breakdown of crystal, which is similar everywhere. All right, abdomen. Not because of less fat, because it has more fat. Abdomen is more fat. Where am I going to inject it? Into the subcutaneous tissue, adipose tissue. It is more there. So that is the reason why it is more absorbed rapidly, right? Right, guys. Now coming to anti-cancer drugs. So we have discussed the first part. The first part was endocrinology. Now coming to anti-cancer drugs. The side effect given in the picture is known as photosensitivity, flagellar dermatitis, Steven-Johnson syndrome, ceruloderma. Ceruloderma. So this has been asked in your exam. I've just changed it and I'm asking you what is this? So guys, as I said, excellent guys, all of you have given the right answer. Flagellate dermatitis, bleomycin. Right. What they can ask you in future, what is the cause? What is the cause? Deficiency of which enzyme causes this? The cause is decreased hydrolase. Hydrolase in two places, skin and lungs. So an enzyme hydrolase, it metabolizes bleomycin, right? And that hydrolase, it is present everywhere in my body. Two places where physiologically we are deficient in this enzyme hydrolase is skin, where it causes flagellate dermatitis, lungs, where it causes pulmonary fibrosis. Because here, if it is not metabolized, it produces free radicals. So those free radicals are responsible. Six-pack abs, lesser absorption. Yes, six-pack ab will have lesser absorption. Right. So excellent, guys. All of you have given the right answer. What is given to prevent the side effect given in the picture? What is given to prevent the side effect given in the picture? Leucovorin, Mesna, pyridoxine, dexamethasone. I guess it's a very simple MCQ. It's not a difficult one. We have discussed this in the section of anti-cancer drugs. What is given to prevent the side effect given in the picture? Leucovorin, Mesna, pyridoxine, and dexamethasone. Why are you giving B Mesna as answer? Mesna is giving in hemorrhagic cystitis. Does this organ look like bladder to you? What is it, guys? What is it? Dexa. No, Dexa is not the answer. You cannot use Dexa everywhere. Guys, this is a side effect called as hand and foot syndrome. This is a side effect called as hand and foot syndrome caused by capecitabine more than 5-fluorouracil. To prevent it, I use vitamin B6. Simple. We have covered this. We have covered this hand and foot syndrome. Your answer is pyridoxine. right? So it's not leucovorin, guys. Leucovorin is given with methotrexate and pemetrexate for bone marrow suppression. It is given with methotrexate and pemetrexate to prevent bone marrow suppression. Mesna is given with cyclophosphamide, ifosfamide for hemorrhagic cystitis, right? Dexamethasone, it is given for nausea and vomiting. It is given for nausea and vomiting. C is the right answer. So, this is a high probability of being asked. Sooner or later, they will ask you. You will see the palms and soles. They can give you soles. If palms are not in the options, they can also give you soles, which are bright red in color like this. There is desquamation, is a highly painful condition. Palbociclib is used for treatment of ovary cancer, breast cancer, uterine cancer, CML. Where do we use palbociclib? It is used for treatment of ovary cancer, breast cancer, uterine cancer, or CML, chronic myelogenous leukemia. Is not a difficult one, right? Excellent, guys. Most of you are giving the right answer here. See, Cislib here, CICL and IB. CICL, it is for cyclin dependent kinase. So cyclin dependent kinase 4 and 6. IB stands for inhibitor. So palbociclib is cyclin dependent kinase. Cisl, it stands for cyclin dependent kinase 4 and 6 blocked. IB is inhibitor. Where it is used from B, you can remember. These are approved for treatment of breast cancer, which are ER positive. And these are mainly used as add-on drugs. Add-on to either tamoxifen or letrozole in premenopausal or postmenopausal female. Simple, guys. So answer is breast cancer. Excellent. Most of your answer is right. I'm proud of you guys all. Which of the following drugs is effective in CML with T315I mutation? Which of the following drugs is effective in chronic myelogenous leukemia with T315I mutation? Imatinib, ponatinib, dasatinib, nilotinib. Guys, I've told you this. You can live CLL, you can live ALL, you can live AML, you can live Hodgkin's lymphoma, you can live non-Hodgkin's lymphoma, everything if you want. But you can never leave CML because CML will never leave you in the exams. Okay. So what is the answer, guys? Now we are getting some right answers. Most of you went for imatinib straight away looking at CML. But remember, guys, CML, if it is CML, drug of choice is imatinib. We know that, right? And if there is no response to imatinib, I can use dasatinib, bosutinib, and nilotinib. Now here, if there is no response due to T315I mutation, I can use ponatinib. If still there is no response, then I can call it as multi-tyrosine kinase inhibitor resistant CML. Here, drug of choice is omacetaxin. I can also use interferon alpha. Guys, this is the bare minimum you should know about CML, and these are all drugs of first generation. These are second generation, and this is third generation. BCR-ABL tyrosine kinase inhibitor. BCR, ABL, tyrosine kinase inhibitor, CML, whatever MCQ they ask you, it will be in and around this particular classification. So here you would have realized what is the answer by now. It is ponatinib, guys. Ponatinib. And ponatinib is the answer for T350I mutation. It's very simple. Cardiotoxicity is seen with all except. So the MCQs in anti-cancer drugs, they are mostly 90% of them are against drugs of choice or side effects. That is what we're going to discuss. Cardiotoxicity is seen with all except doxorubicin, daunorubicin, trastuzumab, and cyclophosphamide. So cardiotoxicity, guys, it has been asked a lot of times. It has been asked in and around these drugs. In and around these drugs. So what is the answer, guys? Excellent, guys. Most of you are correct here. See, better answer is cyclophosphamide. The reason being, see guys, even cyclophosphamide is cardiotoxic, but only at high doses. It causes cardiotoxicity. It's not that it does not cause, but it causes at high doses. So cardiotoxicity is not a usual feature of cyclophosphamide. You will not see in 99% of patients. In 1% where it is used as very high doses, you can see. But even at normal doses, you can see cardiotoxicity with doxorubicin, daunorubicin, trastuzumab. These are three drugs which are commonly asked, right? So here, cyclophosphamide is a better answer. IV fluid that can prevent cisplatin-induced nephrotoxicity. For treatment, yes, we'll be using dexrazoxane, but dexrazoxane is used only for doxo and daunorubicin because here the free radical production is due to iron. So iron chelator is used, right? IV fluid that can prevent cisplatin-induced nephrotoxicity. Is it dextrose? Is it normal saline? Is it Ringer lactate? Or is it Ringer lactate or is it all of the above? It's a very simple one, guys. It's a very simple MCQ. Normal saline. So your answer is normal saline, guys. Your answer is normal saline because normal saline causes chloride diuresis, and chloride, it inactivates cisplatin. Plus then we combine it with mannitol because mannitol will produce forced diuresis and kick out the inactivated cisplatin as soon as possible. So these are two things they ask you, right? Which is used to prevent nephrotoxicity. Fastest absorption of all right, so this is something I've repeated. Which of the following monoclonal antibody is directed against virus? Which of the following mAb is directed against virus? Is it Diridivoumab, Diridavumab, Alorisumab? It is not Alirosumab. So spelling is a little bit wrong here. Fremanezumab, Basilitoxumab, which is against the virus. Guys, I've told you how to recognize. See, mAb means monoclonal antibody. U means it is human source. So it tells us it is mAb. This tells us its source. And here, V, it tells us that it is against a virus. So if it is against a virus, there would be V or VI. For example, look at palivizumab. So mAb source VI. VI stands for virus. Similarly, alirocumab, mAb circulation, and C. C stands for circulation, right? So it acts somewhere in the blood vessel. Mabzu, NE. NE stands for neurology. Somewhere in the neurology, where in neurology? Migraine. Basilitoxumab, MAB, U, and TOX, toxin. Toxin B of Clostridium difficile. Right, so it is used for prophylaxis of pseudomembranous enterocolitis. So if you look carefully, for example, if you look at denosumab, mab UOS, OS stands for osteoporosis. So if you look carefully at a map, you can many a times find out actually where it is going to act, right? So guys, excellent. Most of you have given the right answer. Is A. Side effect given in the picture can be seen with bleomycin, hydroxyurea, 5-fluorouracil, cyclophosphamide. So you can see it probably looks like a limb, and in the limb what I have is an ulcer. So let me tell you what is this. It is a leg ulcer, right? Leg ulcer. Leg ulcer is a side effect. So they're asking basically leg ulcer is a side effect that can be seen with. Is it bleomycin? Is it hydroxyurea? Is it 5-fluorouracil? Or is it cyclophosphamide? What do you think, guys? A, B, C, or D? All right, it's a difficult one. I agree. But I have covered it in the lectures. Painful leg ulcers. Guys, remember, if you don't know, remember, painful leg ulcers, they are caused by hydroxyurea. Hydroxyurea can cause painful leg ulcers. It has never been asked, but it can be asked in our exams. Since hydroxyurea is commonly used in India, the most common use in India is SCD, sickle cell disease. And you know, in India, it is quite common in some communities, right? All right, guys, next question. Aluminum equipments should not come in contact with which anti-cancer drug? Aluminum equipments should not come in contact with which anti-cancer drug? 5-fluorouracil, cisplatin, cyclophosphamide, trastuzumab. All right, guys, we have many equipments of aluminum which can be used, right, in a hospital, and it should not come in contact with. Excellent, guys. Most of you have given the right answer. Your answer is cisplatin, because aluminum inactivates cisplatin. Aluminum inactivates cisplatin. So chloride and aluminum, these are two things which inactivate cisplatin. So B is the right answer. B is the right answer, guys. So guys, these are 20 MCQs that we had to discuss today. Right, I had a very busy day today with some sessions and some recordings and all. But still, as I have promised, I cannot back away, because I don't want to keep on piling up the live sessions, right? And if you guys have any doubts, you guys can ask me, and we'll wrap up this session. And I don't want to take too much of your time, because I'll feel guilty because I know this time is very important for your revision. So guys, keep revising, and whatever you have, right, done until now, and don't try to do a lot of new things in the month of Feb, right? Because the month of Feb should be dedicated, February, for doing or revising only those stuffs which you have done until now. If something is left, forget about it. If it is not too much, too important, or you can do is solve some MCQs for that, right? So the month of February, it should be dedicated entirely to revise at least once what you have done, plus a micro revision towards the end for the 7 to 10 days, right, guys? So guys, for FMG exam, I'll do a session soon. Pradeep Densinghu, I'll organize a session for FMG students who are gonna appear for the June exam. I'll do that. But I'm a little bit tired today, and because of from the morning I had been recording, or the live sessions are going on for Mero. I had an FMG live session for Mero as well, right? Somesh Agnihotri, the drug sensitivity against NSAIDs and antibodies, it never gets cured. It never gets cured. If it is against antibiotics like penicillin, you can go for desensitization. desensitization. शुभम केशरी, सी सबका अलग अलग तैयारी का तरीका होता है। आप ये शुभम केशरी इज आस्किंग, can I do only bookmark MCQ because don't have time to study notes? See, you have to take out time to study notes. The reason being, the topics will be repeated. Now, see, ऐसा नहीं है कि notes पढ़ने का time नहीं है। मैंने आपको पहले ही कहा है, notes में हर गली कोना नहीं पढ़ना आपको. You have to focus which are important parts in the notes. Right. So if I'm studying anti-epileptics, my most MCQs will be asked from drugs of choice, which is drug of choice for GT, CS, MS, absence seizure, and partial seizure. बस इतना पढ़ लो. Then 3 drugs side effects are commonly asked: valproate, phenytoin, carbamazepine. So at least this much you have to do from your notes, so that when new MCQs are asked, right, you have to. So you have to solve MCQs as well as you have to do questions. All right, guys. So that's all for today's session, and all the best, guys. Take care. Bye bye. Good night, and I love you all, and I wish all of you guys in these difficult times keep the spirits high. Don't let the negativity drill through your skull and make you passionate, right? Make you passive. Be active and keep studying. Bye bye. Good night.